Welcome to Health U. The U.S. Secretary of Health is about to announce shocking news. Could Tylenol, commonly used by pregnant women, be linked to autism in children? This controversial statement has caused a huge stir in the medical community. Dear friends who care about health, this topic really needs our in-depth understanding. U.S. Health Secretary Robert F. Kennedy Jr. plans to issue a report warning pregnant women that using over-the-counter pain reliever Tylenol may increase the risk of autism in children. First, let's look at the core of this controversy. Tylenol's main ingredient is acetaminophen, also known as paracetamol. This medication has been used for decades and has long been considered one of the safest pain relief and fever reduction options for pregnant women. Millions of pregnant women worldwide have used this medication. The Trump administration is expected to warn pregnant women to avoid using Tylenol during early pregnancy unless needed for emergencies like fever. If this recommendation is actually implemented, it will have a major impact on global pregnant women's medication habits. But the medical community's reaction has been quite intense. Tylenol manufacturer Kenvue immediately issued a statement responding that more than 10 years of rigorous research, coupled with support from leading medical professionals and global health regulatory agencies, shows no credible evidence linking acetaminophen to autism. The American Medical Association directly criticized this claim as dangerous and irresponsible. Multiple autism experts also expressed skepticism, believing this claim lacks sufficient scientific evidence and completely contradicts current medical guidelines that recognize Tylenol as safe. Let's analyze the causes of autism from a scientific perspective. Researchers have consistently emphasized that the etiology of autism is very complex and not yet fully understood, but the current scientific consensus attributes it mainly to individual genetic factors. The recent rise in autism incidence rates in the U.S. is mainly due to expanded diagnostic criteria, increased social awareness, and increased documentation requirements for accessing support services. Experts point out that the rise in autism prevalence is mainly due to more widespread screening and changed diagnostic criteria. In the past, many patients with mild autism might not have been diagnosed, but now with medical advances and increased social awareness, more cases are being discovered and diagnosed. Taiwan's medical community has also responded to this. Obstetricians and gynecologists point out that acetaminophen is currently a pain reliever that pregnant women can safely use clinically. Years of usage experience show no significant adverse reactions, urging the public not to easily believe claims from non-professional sources. From a scientific evidence perspective, while there are indeed some observational studies mentioning possible associations between pain relievers and autism, most of these studies cannot establish clear causal relationships. Observational studies can only show correlation, not prove causation. This is basic common sense in scientific research. Currently, global health regulatory agencies, including the US FDA and European Medicines Agency, still maintain their recognition of acetaminophen's safety for use during pregnancy. These agencies all have comprehensive drug monitoring systems and continuously evaluate new research evidence. The biggest concern this controversy brings is the potential public health impact. If pregnant women become too fearful to use necessary pain medications, especially in situations requiring emergency treatment like fever, it might actually create greater risks for both mother and fetus, us. The harm of fever to pregnant women and fetuses is clear, especially in early pregnancy, where persistent high fever can lead to serious problems like neural tube defects in the fetus. In comparison, the risks of appropriate fever reducer use are much smaller. Medical experts unanimously recommend that pregnant women should fully discuss medication decisions with physicians and should not refuse necessary treatment due to unscientifically proven claims. Any medication use should follow professional medical guidance and be taken according to recommended dosages and duration. From a drug safety assessment perspective, acetaminophen has undergone decades of widespread use and safety monitoring. If significant risks truly existed, they should have been discovered during this long history of use. Current scientific evidence does not support recommendations to stop using this medication. This incident also highlights potential discrepancies between policymakers and professional medical opinions. Public health policies should be based on the best scientific evidence, not on unproven hypotheses or political considerations. For pregnant women, the most important thing is to maintain rational and scientific attitudes. If pain medication is needed during pregnancy, professional medical advice should be consulted first and decisions made after weighing the benefits and risks. Don't refuse necessary treatment due to panic, and don't arbitrarily increase or decrease medication dosages. In summary, although the U.S. Health Secretary's statement has attracted widespread attention, current scientific evidence does not support claims of a causal relationship between pain relievers and autism. Pregnant women should trust professional physicians' advice when using medications and make rational decisions based on existing best scientific evidence. This is the only way to truly protect both themselves and their fetus's health. We will continue monitoring developments in this issue and hope for more high-quality research to clarify the truth and provide more reliable medication guidance for pregnant women.